Strolling Thunder is an annual event where we 0 to 3 bring families from all 50 states and Washington, D.C. to Capitol Hill, where families meet with their representatives and discuss what they and their babies need to thrive. The issues that our families spoke to their members of Congress don't just go away. Today's event brings 4 of our past Strolling Thunder families back to share more about the issues facing their families and to hear about what they want to hear from candidates running for office this fall. As a reminder, 0 to 3 is a nonpartisan organization, and our work focuses on promoting policies that promote good health, strong families, and positive early learning experiences. We do not endorse candidates or specific legislation, but this forum is designed to spark conversation and highlight the specific issues that impact families and their babies. Please remain muted, post your comments in the chat. If you're a member of the media, please post your questions to the Q&A feature and indicate your media outlet in the question. At the end of the presentations, after a brief conversation, we'll be able to unmute you so that you can ask your questions. We'll ask that you just raise your hand and we'll recognize you in the order that you want to ask your question. And with that, I'd like to introduce today's host, 0 to 3's Chief Policy Officer, Miriam Calderon. Miriam?
Hi, Joe. Thank you so much. Welcome, everybody, to today's Strolling Thunder Town Hall. I see we've got great representation from all across the country, and I think I even saw somebody calling in or joining us internationally. So that is amazing. Today is the first of 3 discussions with families about issues that matter to them. In a moment, you're going to meet 4 families that are joining us today. They represent a diverse set of states, geographically and politically, and they possess a unique perspective on our nation's child care policy as parents who rely on child care for their own children and as professionals with experience working in this sector. I'm so grateful that you've all taken time out of your busy lives to share your stories with us and to help us learn from your experiences about what is needed for a better and more fair childcare system for our country, both for the people who work in it and for our families. During these town halls, I'm going to be speaking with families who have all participated in Strolling Thunder. They share the experience of traveling to Washington, D.C. to advocate for policies that babies and families need to thrive. And as we approach the 2024 election, we want to ensure that our policy leaders and our candidates keep these priorities top of mind and that they don't forget what they heard from families when they visited with them in Capitol Hill this past spring. So in the coming days, we're going to host another town hall with Latino families in Spanish, as you heard Joe mention. And our final town hall will feature discussions with families about what our government can do and policies that they can put in place to address the basic needs and the economic security of families with young children. So I hope you'll continue to join us for this series. Before we dive in and meet our amazing families, just wanted to say a couple things about the childcare crisis in our country. We know the pandemic brought childcare to the brink, and public funding through multiple rounds of pandemic funding helped stabilize the childcare sector. It worked and it helped. These emergency funds have been allowed to expire, but the childcare sector is still struggling, unable to meet the needs of families and our childcare providers. Nationwide, the average yearly cost of childcare rose to $11,500 per child last year, according to Child Care Aware of America's latest annual report. In every state, placing 2 kids at a child care center cost at least 25% more than the typical rent on average. And the price of childcare also exceeded annual typical mortgage payments in 45 states and the District of Columbia. We know the workforce is also still struggling in childcare. In September 2023, the childcare sector was still down about nearly 40,000 workers compared to February 2020 levels pre-pandemic. Pay and working conditions continue to be challenging, yet the pandemic funds that really helped boost pay and retain staff have been allowed to expire. So I want to dive in and we're going to meet our Strolling Thunder families to talk about what they want candidates and their elected leaders to do to solve childcare. First, I want to introduce Jenny Castillo. Jenny and her husband Santiago own and operate a Spanish immersion childcare center in Northwest Arkansas. To say that is amazing. My children went to a Spanish immersion for their whole educational careers. Jenny, please introduce yourself. Tell us about you, your family, and we'd love to hear about your children as well.
Thanks, Miriam. I'm so happy to be here. I actually have 5 children. My oldest is 13, and I got into this world when he was about 2 years old. So childcare has been the center of me and my family's world for the over 10 years, and it's really the most important thing that we do.
Thank you so much, Jenny, for being here and for all the work you do. Next up is Valencia Nelson, who worked in childcare and is pursuing her degree in early childhood education while caring for her daughter. Valencia, please introduce yourself.
Hi, yes, I'm Valencia Nelson. I am married and I have 3 beautiful children, a 5-year-old, 3-year-old, and a 2-year-old. And I am currently pursuing my associates in early childhood education with the dreams of opening my own childcare center.
Oh, that's wonderful, Valencia. I love to hear that you are able to pursue that dream, and we need you in that childcare in this childcare and opening that center. So thank you. Okay, so next, let's hear from Amber Alsowowski, who owns Rocking Horse Childcare in her community, which she opened after her family struggled to find quality childcare for their daughter. Amber, welcome.
Hello, good morning, everyone. Yes, my name is Amber Osowski. I opened Rocking Horse, like you said, because I couldn't find quality childcare in our rural community. My husband and I have 3 children. Cora is in 2nd grade, Lou is in 1st, and Towns is 2.5, and he comes to daycare with me still every day.
That's amazing. What a gift. Thanks, Amber, for being here. Okay, Ilya Gilligan, you were in early childhood education for over 10 years in roles from assistant teacher to executive director, and now you serve babies and toddlers with special needs and early intervention. What amazing experience you have. Thanks for being here. Please introduce yourself.
Thank you so much, everybody. Hi, I'm Ilya Gilligan. I have been in the field, as Miriam said, for over 10 years now. After having my daughter in 2021, my role kind of shifted to a teacher from director. But because of the childcare crisis and how difficult it was, I decided to take a step back from childcare, and now I'm doing early intervention. I have 1 daughter, Penelope, who will be 3 in December.
Wonderful. Well, thank you all again for being here. I'm so excited to hear from you and to dive into this conversation. So let's move forward. So as I mentioned already, the pandemic really upended the childcare sector, but we know it was broken long before that, right? What the pandemic did was really bring a lot of these issues into the forefront and the consciousness of many more people who aren't impacted by the system on a daily basis. So Jenny, Ilya, and Amber, something that strikes me about what you all have in common is that you each started childcare programs in your communities as a direct result of not being able to find quality, affordable infant toddler care that you needed for your own children. We know this is not an uncommon story, right? It's something we hear about for families. So I'd love for all of you to be able to talk about that. And why don't we start with Amber?
Yes, before opening or before having children, I was a florist here in Grafton and I loved it. I did lots of wedding flowers, super fun stuff. But my husband and I, as we started family planning and we had our first daughter, we learned pretty quickly that the quality piece that we were looking for in anyone helping us educate and raise our children just wasn't an option locally. And my background was in early childhood education. And it was finally my husband who said, like, Amber, just open your own center. Like, how have you not thought of this yourself? And so now 8 years in, we're still open, doing great. But we're working hard to raise the quality piece for our community. I have a quality program, but we don't just need more childcare locally or rural America, we need to hit that quality piece too. And that's, I think, where my town specifically is still struggling a little bit.
I think you're absolutely right, Amber. When that was what spurred us to start, was the quality piece. We really wanted the very best for our kids. My background is in education. I taught public school, elementary school for 7 years, and taught orchestra for another 6 after that. So education is my background, and it is my passion. And when we started having kids, we had to put our kids into early childcare and put them in a childcare program. And I was just so struggled with, like, we went to every school in town, and there's some decent programs, some really good things that we saw, but nothing was exactly right for what we wanted for our kids. And it was such a struggle. When my baby girl was born, my second child, we had a gap in care. I was supposed to go back to teaching, and they wouldn't accept babies until 6 months. And it was so hard to try to balance functioning in society and in our roles as professionals, and then also giving the care that we needed for our kids. So I told my husband, hey, how about we open a school and we do this and we give what we want, the very best for our children. And here we are, 11 years later, and we've grown from a 2-room schoolhouse with serving just around 20 kids. And now we have 3 full centers with waiting lists that are so long, and we serve over 300 families. And so we've seen the great need, we've seen what we need, and we've been able to give the best and the high quality to our children, and we continue to raise that up. So I'm right there with you.
Yeah, it was really difficult. The preschool where I was directing at when I found out I was pregnant with my daughter was only 2 and up. And it was in Burlington, which is the biggest city in Vermont. And there were so many centers that were just 2 and up. And there was such a big need for 0 to 2. So I went to management and said, well, why don't we just get licensed for babies? They're like, you can do that. I said, yeah, we can do that. So we did. And then we instantly had 8 babies, 2 teachers, and a wait list. So it was, and that school had been 2 and up for 16 years previously. So that was a pretty big jump to get infants in there. And it was really great. But the only thing is that they didn't really have space for my daughter, even though I was the director, which was really, really tricky. But it was one of the only quality childcares in the area. So we made it work.
Amazing. That I noticed you all mentioned quality as you talked about what was driving you, to open the center. I wonder if anyone just wants to say something, like, how would you explain what is quality? One short sentence. I know that's really hard, but like, you were in an elevator with a policymaker, or your elected representative. What would you say is quality?
In one sentence, Miriam, you're killing me.
I know, right? I couldn't do it.
I tell my staff, we're not babysitters. We are not a daycare. We don't care for days. We're not going to just make sure those kids stay alive, but we are going to give them the very best things that they need to thrive, not just survive every single day. So it's all about brain development. It's about building the whole child, and it starts from birth. It starts from birth. You can't wait till they're 2, like Aaliyah was saying. So that one sentence, it's more than one
That
sentence.
was great. That was definitely an elevator ride. So I'm impressed. We're gonna use that. Ilya, I want to come back to what you were talking about specifically about the crisis and infant toddler care. Could you talk a little bit more about that and what you see as the need?
Yeah, so I think kind of around between the end of 2018 and the beginning of 2020 through 2021, there was this big baby boom, right? And there were so many centers that either couldn't find teachers that wanted to care for infants or didn't have the space. So we really had to get creative. And so what we did was we broke up one of our 2-year-old rooms and created a sleeping area and a playing area. And then once we did that, it was pretty easy to get our license changed. But the hard part is that not everybody can do that. So you know, people were in this crisis where they were like, I have to go back to work, but I don't have anywhere to bring my kid. And, you know, the wait lists were years. Like I had families sending me sonogram photos to get on the wait list. And that was before we even had infants.
We have
So, and
done that.
unfortunately, it hasn't really changed.
Yeah.
It's been almost 3 years and there's still such a need. I even moved cities and there's still a need for 0 to 2. Like it's just, it's crazy and it's hard. What we mean by quality is that we want educators, not babysitters. People are educators and they are teaching our children life skills that are needed. And by quality, the educators have taken the courses, they've done the time, they've put in the work to be called a quality childcare.
Yeah, we see that same thing, you know, at our program. We have a few sparse openings for preschoolers, but our infant waiting list is 28 kids deep. We have people who come to us before they've even conceived. I get messages, hey, we're thinking about having a baby. How does the wait list work? Because those little tiniest babies have the most demands. You know, you mentioned saying, well, because sometimes the teachers don't have the skills or they don't want to, because it is a big risk. These are our most tiny, most important, precious humans, and you have to have people who know what they're doing to really take care of them in the best possible way.
It's just unbelievable to, you know, every time I hear these stories, and we know and we see the statistics, but it's like, you know, to hear families are sending you pictures of their sonograms. It's unconscionable. All right, I'm going to keep us moving, but I want to Valencia turn to you now. You were working in childcare, but you ultimately left home. You left to be at home with your baby. And we've spoken to many childcare providers who've had to make that same choice. Can you talk a little bit more about like how you came to that decision?
Yes. I started in childcare actually, I think before COVID back in 2018. It was actually my first job right out of high school. And because I already knew my profession and what I wanted to do. So I started off as a lead preschool teacher and I ended up pregnant. And I was like, okay, let me try to figure out, you know, childcare for my baby and see how this is going to work. And then they were like, well, there's no discount. And I'm like, wait a minute. You know, because infant care alone, it was almost like $300 a week. And I'm like, I definitely can't afford this. My husband's working full time. And I'm like, okay, well, it's going to be either me staying home with my baby or it's me just working for free. And I was like, well, no, that's not going to work out for me because obviously, you know, in today's time, we need to make ends meet. So working for free was not, you know, feasible. So I was like, well, I'm gonna just stay at home. And I think 2 years later, I decided to start enrolling into school. And I'm like, well, let me get my degree so then I can open my own daycare. So yeah.
Yeah, amazing. Thank you. Thank you for sharing that story. And it's you know, we hear again, it's really ultimately so so unfair that we can't do more to compensate and value the important work that early childhood educators and providers do, so that you don't have to make those trade-offs. But we can see your commitment to the field and going back for early childhood education. So thank you for that. I want to kind of continue on this theme a little bit and talk about this, you know, the staffing crisis, right? Because I think I said at the beginning, we're still down jobs in the sector coming out of the pandemic, and we hear a lot about the challenges with retention, both because of the working conditions and the pay, right? These are really important and jobs that require a lot. So what, you know, when we think about, especially also kind of continuing to bring in infant care, if anybody wants to comment that, but in general, we know there's a staffing crisis. We're seeing it in particular in infant care. Like, what does that mean for all of you? Why don't we start with you, Ilya, but love to hear all of you comment on that.
Yeah, like it's really, to me, it's difficult to understand because I always loved working with babies. But it's really difficult work. It's hard work. Anybody that thinks it's, you know, easy or glorified babysitting, like this isn't putting kids to bed and sitting on the couch. This is teaching and molding tiny minds into, I mean, this is the foundation, right? Like 0 to 3, that's the foundation of what the work is. And it was so difficult to keep teachers once we got them because the pay wasn't commensurate with the amount of work that they were doing. So then I would have to go into classrooms, sometimes in with my daughter, which was very difficult when she was 3 months old. Or I wouldn't be able to take time off, or, you know, like and then we just ran into all these staffing shortages, and we would have to close classrooms, and then the parents would get upset. And it's just this horrible snowball effect. And when I went back to management, I said, we have to pay these teachers a livable wage, because one of my teachers said, I can't afford to live in Burlington anymore because I'm not, like, I can't afford to stay at this job. So that was kind of like a big wake-up call. And the demands and the expectations were not being looked at as difficult as they were. And I think now people are finally starting to realize, like, once the pandemic hit, they were like, oh wow, childcare is essential, and these are essential workers. You know, it's not just doctors and law enforcement and police officers.
I totally agree. I don't think that childcare is truly a respected profession. It's not really looked at like that. I get asked all the time, what are you going to do when your kids are older? Like, are people asking doctors or kindergarten teachers, like, what are you going to do when your kids get older? Like, no, this is what I chose to do with my life. I've invested my time and money and education into this. Like, I don't have another plan. I'm going to keep helping families. So I think that's so hard to train even your own staff to see. Like, you are respected in my center. My families will respect you. Being treated like this is your career. You're so good at this. You're so needed, and letting them learn that, but also believing that inside, and turning around kind of the table of, I can do this for my whole life. I'm really good at this. The kids need me. That's hard. That's really hard.
Yeah, that's huge, Amber, is just recognizing that this is a career path. This is a profession. And, you know, it's interesting because the parents expect them, the teachers, the staff, to be professionals, to be experts in child development and in the things. That's what everyone wants for their children. But then if they're not giving the respect and the wage that is deserving of professionals and experts in child development, it doesn't square up, it doesn't match. You know, we have an extra level of importance here because we are a Spanish immersion center. And so all of my staff are bilingual, and that is so important, you know, but then it's just the difference of, well, how are we treating our staff and how are we training them? What are we investing in them so that we can take it to that next level? It's just, it goes down to training. It goes down to a respect issue. And like, you know, I feel for you, Valencia, of having to, you know, leave and go into that because it doesn't work for them, and not everyone can afford to even pay for their own kids, you know. And as an owner, there's a little difference. Like I'm the one that can make those decisions and I'll provide the free or discounted childcare to my staff, but we have to make ends meet too. We're only privately funded. We are completely dependent on the tuition of our families. And so if we don't have an income, we can't pay our staff what they are deserving of, you know.
Yes, and honestly, from my point of view as an employee, my issue was not getting paid what I was worth. So even now with my, I have a technical diploma and I'm pursuing my degree, a level 11 on the registry, I was still going to interviews and they were still wanting to pay me less than $15. And I'm like, that's not going to work. I'm like, no, I can't live off of $13 an hour, you know, and supporting 3 children, you know, I just couldn't do it. So that was one of my biggest issues. And that's probably one of the biggest issues in 2024, why staffing prices are, you know, nobody want to work because we're not getting paid enough. It wouldn't work.
Absolutely. I want to, so let's dig into that a little bit more. So, some of you again have perspectives, as you said, Jenny, as owners, directors, you can make decisions about pay, right? And benefits and that. So tell us a little bit more about like what is, let's get into what's the challenge and I think kind of the problem here, right? About being able to hire more workers, being able to pay them better, as likely means raising the cost for families, right? So let's dive into that challenge.
Exactly. So that's the other challenge that we've got. One is that quality piece and wanting experts, but then there's the dollar sign of I want to put my kids in a quality program, but I can't afford to pay more than that. But then we can't afford to pay our staff what they need in order to really thrive and grow. I feel like we're a little bit spoiled in Arkansas. We have wonderful professional development that's provided through the state, and it's wonderful. However, then you can't, turn around and go back. The government is providing us a little bit of subsidies, and which is wonderful because we can accept those government vouchers for kids who are low income, those families that qualify. But you guys, I've had a family just last week that had to withdraw their kids from my program because mom got a raise, was making about 20 bucks more a week. But just by making that $20 more in her job disqualified her for her vouchers. And so instead of paying $30 a week for childcare, she was going to have to pay close to $300 a week. And so she can't, the difference doesn't add up. So she ended up having to pull her kids, and, people are declining raises and that kind of thing. But it's just it's not enough, and it still isn't matching up to make it work,
Yeah, and that's a lot of the problem with a lot of the smaller childcares, right? Like that start out, like you said, Jenny, with like 2 rooms that then expand. Where I was working, that wasn't the case at all. And that was the strange part. So it was part of a big corporation that actually has, I don't know, 150 centers throughout all of New England. And when I was leaving that job, I told the CEO exactly why I was leaving. And I was like, this isn't sustainable for me. It's not sustainable for my family, because my salary was also not commensurate to the 60, 75 hours a week I was working. And I told them once I had my daughter, I was not doing that anymore. I needed a work-life balance. And one of the things that he said was, 70% of the tuition goes to the teachers. And I said, it actually doesn't, because I do the payroll. So where was that money going? There's a huge disconnect in all these larger centers where they're charging, $1,500 a month or more. I think the most that they're charging right now is, I think it got up to $2,200 a month. But the teachers are only getting, like the max was like $19 an hour.
Yep.
And they don't have health insurance. So like, where are all these costs going? I think that's a really big problem that people aren't necessarily addressing, that definitely needs to be addressed. And then as far as the smaller centers, like where Jenny and Amber are, like, you don't get to, like, you have to have enough people in order to pay them enough, because there's not enough vouchers and there's not enough subsidy. And like these poor people that get a raise, it's like, hooray, I got a raise. And oh, just kidding. Like now I have to quit my job and stay home with my children, like Valencia, because it doesn't make sense to work when I could just be at home with my child.
Yeah. And I think, when we talk about quality, one of the things that comes up is ratio. Well, how many kids because we've scaled, I've seen both sides of it. Now at 3 centers with, 300 kids, we finally, as a company on the business side, got to a point where we can't afford to offer medical coverage to our staff. So there are perks to being that higher level, that more profitable, I guess, company, because you do have a little bit more processes set in place so we can offer more to our staff. Right now, we pay our staff better than anyone else in town. And we're, you know, but that's because we don't pocket much of anything, you know, but then it's like, well, how can we grow? How can we meet the needs of the wait list? How can we provide more things to our teams? And then I feel like on the quality level, as we grow, it's like, well, then how can I keep my finger on the pulse and make sure that everybody's doing the right thing? And that it's, as a parent, sometimes I would prefer, you want to know exactly who's in that room. A small center where you know everyone is oftentimes is more preferable, you know, like what Amber's doing. But pros and cons, right? And then how do we meet the needs of everyone? That's what we're here about.
I think public education is a big piece to this puzzle too. It's, as a childcare provider, we don't always have a whole lot of time for things like this. But if you've never worked in childcare, it's hard to understand how much energy, how much time, and how much money goes into running a quality program. And the public perception still kind of seems to be that childcare isn't worth the money. And we kind of need to change that to a view that, like, this is an investment in your child's future. So if you want quality and you want a return on your investment, you're going to have to put some money into it, which is, I know, hard. North Dakota's done a really good job. Recently, they started a program that the state actually like picks up the tuition of childcare employees. So my staff who have children that come to get, I know, huge clap, like amazing. All the staff that work at my childcare and have their own children, the state covers everything. So I actually just yesterday hired on another staff. My center is growing and I've gotten to like get ahead of the curve a little bit and provide more quality care to some of these other families who wouldn't be able to get in otherwise.
Absolutely. You've all done just such a, I think, a brilliant job of kind of framing really like the conundrum, right? Families can't afford to pay more. What families can afford to pay can't really cover the cost of being able to pay your staff, you know, wages that is commensurate with the importance of the work, the value, the skills and expertise that are required, right? And there's this gap, right? And to retain these very talented early educators in programs and benefits, right? We've talked about benefits too. Benefits like discounts, benefits like health insurance, right? Which are really essential. Retirement, et cetera. So I guess there was, you know, I mentioned this before, the pandemic, the pandemic era funds, right? The emergency funds that were so helpful during a lot of that, you know, went directly reached many childcare providers and businesses and states. I wonder if any of you have something to say. Seeing some questions here about what's that gap, right? What's the solution? So this is a little bit maybe a solutions question. If anybody just has thoughts on it, like what, you know, public funding came in and provided money directly to childcare programs during the pandemic. Anybody have experience with that? Any of you want to say anything in receiving those funds and how they worked?
I mean, I know that I was asked that question about, hey, the funding has ended. And I'm like, I'm pretty sure our funding ended quite some time ago. And we felt that, you know, it did help us survive through the pandemic and get our feet back under us. I don't know what the answer is, you know, and I think that's why we're here. We're having these conversations so that we can get to the root of the issue. I know that being able to get access to funding for smaller centers and for private childcare providers would be incredible, you know, because everyone's trying, everyone wants the best for kids. And we just have to figure out how to allocate it and figure out how to get what we need for our students, to get the education that our staff needs and deserves, and to get that funding back into their hands. So keep doing what you're doing. Everybody's got to keep fighting for our babies because they're the ones that are the future. They're tomorrow.
The COVID funding allowed me to retain all the staff that I had. When everybody was staying home, there was not as great of a need for childcare. Teachers were keeping their kids home. You know, anybody who wasn't going back to the office kept their children home. And I kind of looked at the families who are in my care, and I looked at my staff and I thought, if I tell these ladies who work for me to go home, like they're going to have to either find other jobs or they're going to go somewhere else, and there isn't going to be a daycare to come back to. Like, how am I, when everything opens back up, how am I going to open up my center again with no staff, or everybody's going to have to be brand new? So the COVID funding allowed me to continue to pay them their wage, whether or not they were working all of their hours. And so it saved Rocking Horse, no doubt. But now we're back where we were pre-COVID, where we're still like, okay, what program can we implement this month to make the ends meet, to pay you what you're worth, to get the right training? It's a broken cycle.
Right, absolutely. Yeah, I know at 0 to 3, we are, along with many other, partners, continuing to try to lift up, the emergency isn't over for childcare, right? That funding gap and that need for funds. What we saw, many of those resources went to pay, like you've all talked about, boost wages, a lower cost for families, right? So we think that bringing more public funding into the sector is part of kind of solving this puzzle. Well, I'm gonna open it up now to make sure we have some time for questions and Q&A from the audience. But thank you all for that wonderful discussion so far. I will kick it over to my colleague, Joe, who I think we wanted to see if we've gotten any questions from members of the media or anyone from the audience.
Yes, thank you. We really hate to interrupt this lively conversation, but we want to make sure that everyone everyone who has a question has an opportunity to be heard. We have one in the chat, and I see one hand raised. Ashley, it would be great if you dropped your question in the chat, and we'll recognize you. Our first question from Sherry Barber: is an increase in time and paid FMLA, family medical leave, a viable option to nationally address the infant care crisis?
Where that would benefit the teachers. I don't know if it would necessarily benefit the centers, but again, it depends on what kind of center and how big it is. Some centers that are small can't really offer FMLA, even though it's like a federally funded thing. A lot of people have to go on short-term disability. So unfortunately, I don't think that's the answer, but I think it's up to the states and the government to listen to the childcare providers and really help figure out what the issues are.
If I'm reading the question right, I think what she's asking is if employers would pay their workers more, will give them more time, not working in childcare, if they will actually give them more time and give them more paid leave. And maybe then it wouldn't be so much, with trying to figure out infant care in the childcare centers. Then if I'm working a normal job, I can stay at home like up to 6 months because I know I'm getting a longer FMLA to take care of my baby and not having to struggle like, who's going to take care of my baby because I got to go back to work. I think that was more where the question was going to. And honestly, I know as with my husband, if he had a better FMLA, not having to go right back to work to help me out at home with 3 kids, that would have been amazing,
Yeah. Thank you so much, both for that. It's such a great point. Valencia, I think the way, at 0 to 3, we really talk about, an agenda that is going to meet the needs of families with really young children. And we know that something like, paid family and medical leave is a critical and important piece of the puzzle, right? So families want that time to bond, right? And provide that that really incredibly important time, in that developmental period, to be able to be with their children. We hear that so much from families too, right? Like in those early months in that first year, right? How much that many of them say that would be my preferred, right? Like sort of childcare option. Of course, every family's or care option, I should say. Every family circumstances are also different. So I think the answer is really, what does the policy look like, right? And you get into some really important details about how long. I guess to the question of, does it solve an infant care crisis? Really, that depends. Is it a full first year? I don't think we have any states here. We have countries around the world that provide a year, right? Paid leave, what does that paid wage replacement look like, right? And is that, how many families really are going to be able to take advantage of that option, and still be able to provide, for their family. So a lot is in the details, but we think it's an essential piece of a broader set of supports we know we need to have in place for working families, right?
Our next question is from Megan Pryor. Megan is a pediatrician and talks about childcare on Instagram at Itty Bitty Revolution. She's read about cost modeling as a method that the government can use to pay providers what they need. Essentially, states figure out what childcare should actually cost if you paid staff well, and that's what the centers get, even if it's higher than current tuition. As I understand it, several states, including New Mexico and DC, and now her state of Virginia, are using this. What do we think about this as a possible solution to the crisis?
I think it would be a great solution, because then they're going to really look at what does it cost to run a center, and then give us the money that it takes to do it. I think that where you're going to run into some pushback on that is, well, who decides that number and how is that determined? And then how do you follow through and make sure that the providers are actually taking the money to put into paying their staff what they need, and not just, if you get into a big company like with corporate level, like Ilea was saying, and they're just pocketing the money and not, giving it back to their team. So it's just gonna end, well, I think it's a great solution. Do it, you can do it, but then you got to follow through, and there's got to be some checks and balances in place to make sure that it works out.
Yeah,
Yeah,
I agree. They need to be held accountable to make sure that the actual numbers that they're coming up with is going to the center, and that nobody's pocketing it, and that nobody's just making up random numbers. Like, there needs to be brass tacks at the end of it.
I agree. I think that's a good potential solution. I would imagine it'd be really hard to come up with that number as I'm scaling to a larger size. And we're looking at things like, a fire suppression system and new air handling system and asbestos abatement. It's really hard to quantify how much it actually costs to open a new place and what those slots would cost once you pay for just the building that you're going into. And then you start staffing it. Like, I mean, if they're doing it, great, teach us how, but that's taking more brain power than I have right now to figure out.
Yeah. Anyone else want to jump in on this, or no? Okay. I think I'll just add, I really, really appreciate that question, Megan. I think as has already been said, a lot of this is, really neat. It has to be done well, right? And I think one of the hard, more complex parts of this cost modeling solution is really figuring out what to pay providers. And I think as has already been said, I think it was you, Ilea, right? You were told 70% of the costs, right, are really the labor costs, the cost to pay providers. And so those choice points are really important in being able to engage providers in the solution. And the other thing is the public funding, right? So calling out, like, DC has, a first in the country, pay equity and effort for early childhood educators that is public funding. And, New Mexico voters have passed universal early childhood education for the state, right? So this is, it goes hand in hand with being able to bring more public dollars, I think, into the sector, and making the decisions about what is fair and equitable pay for early educators are when you do those cost models.
We have one additional question in the Q&A. If anyone has additional questions, please post them, and we will be sure to ask after this one. This is from an anonymous attendee, but I think it's relevant. Could you share grant information that will help families pay for private nursery schools or public nursery schools. Where do you go to help families who need support, and what programs should we be looking to expand?
I don't really know of any programs that we can tap into on the private scale level that can support, you know, families and paying for that tuition. I mean, on a large scale level, I know that there's we've got some families who are able to tap into resources with Childcare Aware that are military families. We've got, of course, low income families that are, and foster kids who are able to access funds through the state. But I don't, beyond that, like, that's all we got. You know, there's not a lot. We could use some more. If you know, I want to know the answer to that too. So
Yeah, I don't know of any grants that would go specifically to the family. There's a few programs in North Dakota, like the one that I mentioned. They'll pay the tuition for childcare employees. There's childcare assistance for low-income families, or lots of families qualify for that now in North Dakota. It was just expanded. But really, it's on the provider to go and seek out the grants to bring more money into the program so that I don't have to raise the costs. There isn't anything that I know of on the parent side.
Yeah, there's not a whole lot. Vermont did recently pass a childcare bill, Act 76, which raised taxes for Vermonters that can help bridge the gap between tuition costs and how much the teachers are getting and what the center costs are. And everybody panicked because, you know, raising taxes is really stressful, but it only ended up being about $20 per resident in Vermont. And that created access for about 10,000 children to go to preschool and early ed. So I think there are ways you can do it. I don't know, there's not a whole lot of grants necessarily for parents, but if you do like the kind of the cost model, it's kind of what Vermont did. If you really dive deep into it, you can try to figure out how much it would take to make these things possible, right? There's places popping up all over the country that are doing childcare laws. I believe Vermont was the first to actually pass it into legislation. And I think that it's not necessarily easy. It's definitely very difficult. But I think that there are ways to help get more public funding.
Hey, thank you all so much for that. I think I'll just add that states all have both local and childcare resource and referral entities. So I think if you're searching in your particular area, and that is a resource that I think can be really helpful in trying to find, you know, what those different programs are that folks have touched on and mentioned. But, you know, unfortunately, many of them, they vary, right, from state to state. And unfortunately, there's many, and a lot of them depend on the circumstances of your family, whether you qualify. So something like a childcare resource and referral agency is a service that's there to help families like understand the various programs and what the eligibility requirements are.
Working at one of those centers now. So if you hear
that's
screaming children in the background, that's because it's late.
That's right.
We just have one last question, but it's really what Miriam was going to ask as our close. It's what do you feel is the most important takeaway you would want the public to know? So we'll table that for just a moment, and Miriam, we'll turn it back to you to ask your final questions and then say our thank yous.
Yeah, okay, great. Well, thanks all for that. So yeah, I think as Joe kind of set up here, we are, you know, as you're thinking about the upcoming election, right, and and the importance of voting at the federal, state, and local level, what do you want candidates to hear, right, particularly as they think about, you know, childcare and infant care and the workforce? So Ilya, why don't you start us off?
I think, oh man, it's so hard to like put this into words. The takeaways, correct?
Yeah.
My big takeaway, this is a profession. It's a profession. The teachers need to be respected, even if they are teaching infants. They're still teaching them. They're teaching him how to eat, how to sit up, how to do tummy time. And basically just for people to understand that I've worked a lot of jobs, and childcare is the hardest job that I've ever had. So I think if there was one point I'd really want to drive home is that this is a profession, and it should be treated as such with commiserate pay and commiserate respect.
Thank you, Ilya. Well said.
I would add to that, on that same note, that this isn't daycare. This is early childhood education. I want people's eyes to be opened to that education piece for these little ones, and that setting up a good foundation and a love of learning needs to start so early. If we want confident, well-rounded children growing up in our country, we have to make those years count. So the early years for infant and toddlers it's really an untapped resource. Providing quality care from supported staff is something that our country needs to capitalize on now.
Great. Well, thank you, Amber.
Yes, and one of my biggest things is I would want them to put themselves in my shoes. If you were me, low income, middle class, and you wanted some good quality care for your children, what would you do? So I would want them to be me. Look at childcare as what it is. We're shaping the kids of tomorrow. So if to do that, we need quality, we need affordable, we need educators, not just babysitters, and just think about the next person, basically.
Wonderful. Thank you, Valencia.
Just so important to recognize that it's necessary. Infant and toddler care is essential to all of us, to all of our families. It's what we want for our kids, and it's what we need to provide them. I know when I was speaking with some of our 0 to 3 representatives, I said, I finally gotten there for my kids, for the children that I serve. Like, we're finally accomplishing this. It's possible. It can be done to give them the very highest level of care and to provide staff with something that is wonderful and a great environment for our teams also. But we need more. We need more support. I can't say that loud enough, that it's in general, our centers, I think those of us that are in this room, we are some of the elite. Our kids that we're passionate about this. We want the best for our kids, but not everyone is able to access it. Not everyone in my community is able to access what we're providing for these students. And in order for everybody to get what they need, all of our kids, they can't just be born into privilege and get what they need. We need for all of our students to be able to access the wonderful, high quality childcare and education, like Amber is saying, that it is education, it is learning for them. And we need the support. We need everybody that's in here, anybody that can listen. We'll shout it from the rooftops. Our kids deserve it. Our providers deserve it. And we are grateful for your support. We're grateful for everyone for taking the time to be here and to listen to the things that are so basic and so important to all of us.
Well, I'm grateful to all of you once again for taking this time, for sharing your wisdom with everybody that was able to join, and everybody who will hear this kind of all across the country. I hear you really saying this is, childcare is an essential support for families. It matters for healthy development of our babies. This is the time that the work that you do is building brains, right? Building learning and development and good health that sets the foundation for the future, right? And there is no way to do that for more families without, like, the road to the solution goes right through our early educators and our childcare providers, and doing better and right by them, and valuing and respecting them, and compensating them well and ensuring good supports and working conditions as they do this really important work in partnership with our families. So I think we have the answers, and we have some bright spots in all of the work that you all are doing. And I think in states around the country, as you've heard a little bit today, and we need greater action at the federal level. And we know this is going to be top of mind for many families that are voting this election season. So thank you for helping frame up these issues. I want to thank everybody in our audience for tuning in today. We're really grateful that you took this time to engage with our amazing Strolling Thunder family leaders. I want to remind you again, there's information and links in the chat to be able to register for our the rest of our series. Again, September 25th, we'll be talking with Latino families in Spanish, and then our final town hall on October 1st, where we'll be focusing on economic security. I want to remind everybody tuning in, it's really important to vote. Yesterday was National Voter Registration Day, right? We want to turn out and we want our elected leaders and our candidates to know that we're paying attention to what is being said and the commitments that are being made about how to address childcare and the needs of infants and toddlers and our nation's families. So please think babies and vote, and tune in for the remainder of our town hall series. Thank you all so much, and thanks again to all of you for your leadership.